Hello everyone. In last part 1 video, we saw about what is myasthenia gravis and what are the causes, what is doing in the myasthenia gravis. In this video, we are going to see its clinical examination and how we are going to treat it and how we are going to treat it physiotherapeutically or surgically. In this video, we are going to see this clinical examination for myasthenia gravis. We are going to see a clinical examination like how is the symptoms getting evolved. If the patient is getting a myasthenia gravis in the first stage, then the severity of the symptoms will be very less. Then we can't be able to do with the symptom evaluation. We are going to evaluate it with the neurological testing. In neurological testing, we are going to see about some motor functions, reflexes, sensory perceptions, coordination, and abnormalities which are basically identified. When he is walking, we can know. We can able to know that he is getting fatigue easily, or his breathing pattern is very different from normal. If it is a symptom evaluation, then the patient report. We are going to get into a reported analysis of the patient's symptoms, including onset, duration, severity of various clinical manifestation that aids the diagnosis. In neurological testing, we can also include the NCV. In nerve conduction velocities, we can easily diagnose that the nerve is not getting stimulated, or the nerves are not taking the stimulus to the correct muscle. We can easily diagnose it by NCV. And for laboratory test, we can easily detect that if there is an antibody which is against our immune system, specifically auto antibodies. If we detect auto antibodies in the blood, we can get to know that there is an autoimmune disease that contributes the patient's symptoms. Then in the EMG, we can easily diagnose that the muscle is not properly activating. Then we can conclude that it is a autoimmune disease, or it's a myasthenia gravis. Then in imaging studies like CT and MRI, we can visualize the internal structures, the abnormalities of the injuries, about physically or symptomatically. In treatment options, we are going to see about medical management. In medical management, we can give that anticholinesterase medications. The anticholinesterase medications are like that. It's against the anti-acetylcholinesterase. The acetylcholinesterase is the main enzyme which is inhibiting the acetylcholine production. If it is inhibiting the acetylcholine production, our nerves cannot be able to pass the signals to nerves to muscle. If it is not producing the acetylcholine, if the availability of the acetylcholine is very low, then neuromuscular junction can't work. If the neuromuscular junction is not working properly, our muscles are not getting these signals from the brain. Then our muscles won't get strength. It will go for flaccidity. Then the patient is getting very fatigued. He can't able to walk. I already said about in the clinical features. Then we are going to start immunosuppressive therapies. Immunosuppressive therapies means that reduce the immune system's activity. By reducing the immune system's activity, we are inhibiting our own antibody production, which is getting against our own immune system. Then in surgical procedures, we are going to do thymectomy. The thymus is the main gland which is producing the main autoimmune disorders, which is producing the auto antibodies of our body. If we remove the thymus gland surgically, then we can easily overcome the myasthenia gravis. If the indications are become very severe, then we have to do some specific markers, improvement, reduction in reduce the medication dependence. We have to increase the muscle strength. We cannot stop the myasthenia gravis, but we can able to make it very fastly, but we can't able to stop. Okay, then in lifestyle and supportive therapies, we are going to see about physical therapy and dietary activity modifications. In physical therapy, we are going to, I will discuss it later about the physical therapy in another video. In dietary activities, we are able to take nutrients and we are able to getting modifications of taking fatty foods or any MSGs. In overall quality of life, we are increasing it. Then we are getting it very much of good energies, good nutrients. Then our myasthenia gravis is not at all a problem. Then in what's the progression of this disease? If you ask like that, okay, in the next video, we are going to see about the treatments of the myasthenia gravis, which is a DD-based video. The students are going to perform it, the exercises of the myasthenia gravis. Thank you.